Hey everybody, how are you tonight? Dr. Stephanie Stroud here with Cornerstone's Pet Tip of the Week. How are you guys? I hope you've had a great weekend and hope you had a good Monday and you are ready for this week. So I'm going to talk today about some of the things, or one of the things that I see really commonly on emergency visits and even during the daytime, but I see it more often during my emergency visits. Also something that we are likely to see more of coming into this fall, and that is snake bites. Okay, so it is the time of the year where summer is kind of ending. I know, so sad, but we're ready to come into fall time. So lots of fun, awesome things about fall. Fall and autumn is actually my favorite season. But it can come with some dangers, and one of those things is we tend to see more snake bites during this time of the year. Why is that? Well, the most common reason is because snakes are getting ready to go into hibernation, or the weather is changing, and so you're more likely to find snakes trying to warm up on a rock or on bricks or in the gardens and so forth, trying to find warmer areas as they're trying to regulate their body temperatures and getting ready to go into hibernation. So of course our pets are so very ornery and they go and find them. It seems like they sniff around and you may all of a sudden hear a yelp or a cry. You didn't see anything, and so then they come back in, they eat and drink their dinner, and everything's acting normal, and then all of a sudden you see this massive swelling and it freaks you out. Okay, there's lots of things that can cause massive swellings, but one of the most common things I see this time of year is actually that being due to a snake bite. Okay, so what do you need to do if you suspect your dog or cat got bit by a snake, or what do you need to do if you know for a fact you saw it? Okay, well, the first thing to do is stay calm. Okay, I know it's really scary and it really probably gets your heart pumping and makes you really anxious, but stay calm. Okay, what I recommend is get that number off your refrigerator or out of your wallet, like I've talked to you about before, the number for the emergency veterinary hospital in your location, or the number to your primary veterinarian. Okay, first thing I want you to do is I want you to call them. Let them know that you suspect your pet got bit by a snake, or you know that your pet got bit by a snake, and call them, set up an appointment ASAP for them to be seen. Second thing is, if you identified the snake and you have killed it, take a picture of it for verification so that your veterinarian knows exactly what kind of snake bite they're dealing with. Most of the time in this specific area in Joplin, Missouri, we're dealing with copperheads. Okay, that is the most common thing we see around here, and they cause massive swelling and pain. Okay, so when you take your pet to the veterinary hospital, they are most likely going to start them on an anti-inflammatory and pain medication. Most likely will also start them on some antibiotics for prophylactic reasons, trying to prevent any infection, because a bite can carry disease and bacteria in the bite. Okay, so we want to protect against that. And they may most likely will recommend hospitalizing them for at least 24 hours or overnight. That way they can observe them, make sure that the swelling is going down, make sure that we're not seeing other signs. What else can you see with a snake bite? Some of the things that we tend to see, and it doesn't occur right away, but this can happen anywhere from 5 to 7 days after the bite occurred. Sometimes with the copperhead bites that we tend to see in this area, we will see skin sloughing. And so your pet all of a sudden, sometimes the first thing you see, you don't notice the swelling because it's not that bad, but you see all of a sudden they have this area of skin that just seems to have fallen apart, and it's really red and raw and bleeding, and it looks infected. Well, that could be a sign of a snake bite too. And so that is why we often will start them on antibiotics. And so the two things you need to do if you suspect a snake bite is to call your emergency or your primary veterinarian right away after remaining calm. And the second thing is, if you have killed the snake, you were able to identify it, go ahead and take a picture, bring it to your veterinarian. Your veterinarian will be able to help you get started with whatever treatment you need to use. There are some different types of snakes, the venomous snakes, that we worry about. Do we need to use anti-venom? Most of the time with copperheads, we don't tend to use anti-venom, but sometimes with rattlesnakes we will. Okay, and so if you can identify the snake, that is the best thing to do. Okay, if you can't, it's okay. that still sometimes happens, and we use our best judgment and we help them how we can. But if you have questions, if you have concerns, be sure to drop a comment below. We're always happy to answer them, but watch out for those snakes. Making sure you keep that brush and the leaves and everything hauled away. Those are places where the snakes will want to hide. Keeping your pets as much as you can from being ornery and getting into things like that, and keeping them out of the woods as much as possible. Keep them more in the yard or on leash to go on nice long walks as this weather cools down and you guys enjoy it. So that's what we need to do for snake bites, okay? All right, I'll see you guys next week. Have a great rest of the week. Bye-bye.